Hello everyone, welcome back to Top Point Healthcare Training Hub. Today I will be showing you all how to check your vital signs on your resident. Vital signs is very important. When there's a change in vital signs, always make sure to report to the nurse. So today I'll be showing you all how to check your blood pressure, your pulse, respiration, and also oxygen level. So when you come into Miss T's room or when you come into your residence room, always make sure to knock. When you come in, you introduce yourself. So I did introduce myself to Miss T, and you also let Miss T know what you're coming to do. So I make sure I sanitize my hands, close the privacy curtain, and let Miss T know that I'll be raising her bed. All right, Miss T, I'll be raising your bed. Why I'll be raising the bed is so I don't bend so much, okay? So let's go ahead and raise Miss T's bed. Miss T, did you have a good lunch today? I know you did. So once I have the bed raised, I'll let Miss T know that I'm going to expose one of her arm, which is the hand that I'll be using to check the blood pressure. All right, Miss T, so I'll be using this hand to check your blood pressure. Right here, I already have a clean surface for my equipment. I have a towel, I have my blood pressure monitor, I have my stethoscope, and I also have my pulse ox. We can check Miss T's blood pressure either by using the manual. It's also called sphygmomanometer. So we can either use this or we can use the electronic. But for the purpose of the CNA class, we will be using the manual blood pressure cuff. So we'll make sure to place the blood pressure cuff on the right position. As you can see, this is the right position. And then put on my stethoscope. Lock. And then hold this down. So now I'm ready to check Miss T's blood pressure. I have my stethoscope on. I have the blood pressure cuff on Miss T. I go ahead and lock this all the way to the end. Place the diaphragm of my stethoscope right in front of Miss T's elbow and inflate. When I get to my ideal number, I go ahead and start deflating gradually. Once I start hearing the sound, the first sound that I hear, it's going to be what the systolic number is going to be. And once I hear the last sound, that is going to be my diastolic number. And then I go ahead and deflate all the way. So for the blood pressure reading, the line goes up to 140. Once I let it go, it starts going down. The first boom sound that I hear will be my systolic. And that is, let's say for Miss T, I have 128. And then I keep hearing the sound, and all of a sudden I stop hearing the sound. What number the sign is at that time is going to be the diastolic number. So for Miss T, I have about 72, and I just let go all the way down to 0. So now I have Miss T's blood pressure. I put it down on the paper. I go ahead and get the blood pressure cuff out. The normal blood pressure range for the systolic is 100 to 120, and for the diastolic is 60 to 80. The next thing we'll be checking is Miss T's pulse. So for Miss T's pulse, you can check pulse in different places. There is the temporal, there is the carotid, there is the brachial, and there is the radial. So for today, we'll be using the radial pulse. So for radial pulse, you use the thumb and get where the radial pulse is. You can also play around before you can be able to get the right position. So for Miss T, I go ahead and hold this and I check for a full 1 minute. You can also check for 30 seconds, but for Miss T, we'll be checking for full 1 minute. Normal pulse should be 60 to 100. If it's over 100, the patient can have tachycardia. If it's below 60, it can be bradycardia. So for Miss T, let's say she's normal and hers is 82. At the same time, so for respiration, we shouldn't be telling the resident that we're checking respiration. Once you tell the resident that you're checking respiration, that can cause a fast respiratory rate. So what we do is we pretend like we're still checking the pulse, and at the same time we're checking her respiration. Respiration is also checked for full 1 minute. Normal respiration is 12 to 20. For respiration, you count for if chest rise and so for the inspiration and expiration, that's 1. So when they exhale and inhale air, that's 1. So that's how you check respiration. So for Miss T, her respiration today is 16, which is normal. If I have to check her oxygen level, this is what you use to check oxygen level. You turn the pulse ox on and open this up and put Miss T's finger. You just watch for the O2. So for Miss T today, her O2 was 96, which is normal. And you also specify if the resident is on room air or if they have oxygen on. So I'm done checking her blood pressure, her pulse, respiration, and oxygen level. At this time, I'll let Miss T know that I'm taking her bed back down so I don't scare Miss T. I also put her head to a comfortable position. And then I let Miss T know that her call light is available when she needs it. And I ask if she wants water or ice. Miss T says she's doing okay. I go ahead and clean out all the equipments that I have, sanitize my hands, and report my findings to the nurse.